demonstrate this Biotech Hemi arthroplasty kit, which is quite handy. So you open up the shoulder as per your preferred approach. I usually prefer a deltopectoral approach, and after the humerus head has been exposed, we take a humerus head cut. There are two jigs, right and left sided, that can aid your cutting angle and retroversion. And then we are opening the canal. So there are 3 stem sizes in this particular system: small, medium and large, which equates to 6.5, 7.5 and 8.5. So you start with a small one, and then you have medium and a large, whichever size fits on the reamer. You then use the rasp in suitable retroversion, and the rasp has to go until all the teeth have gone inside the bone, inside the cut. So you should not be able to see any teeth. In case of trauma, it is sometimes difficult to gauge the level, but in case of elective surgery, this laser mark is given, which is the level where you have to insert the rasp to. And then there is a Tommy bar, which you can use to knock it in and out, and it also gives you some idea of the retroversion. Meanwhile, after you cut the head, this is a standard head sizer, which gives you an idea of the head that you need to use in that particular case. So as I mentioned earlier, there are 3 stem sizes and there are 5 head sizes. So there are 3 stem sizes, as I mentioned earlier, and the 5 head sizes, starting from 35 and going up to 45. And all the sizes can be mix and match. So you can have any head size going on to any stem size, and they all fit via a standard Morse taper and the stem is cemented. Okay. So in terms of the height of the stem, again you follow the standard landmarks. In case of a trauma surgery, insertion of the pectoralis major tendon is a good landmark to have, or you can have the highest point of the humerus head about a centimeter under the undersurface of acromion. So these are 2 common landmarks that I use. So after you prepare the canal for cementing, there is a inserter tool that you can use to fix and insert the stem. And if you are still not sure about the retroversion, then there is another guide where you have left and right sided holes in neutral, 10, 20 and 30 degrees of retroversion. So you can just put a Tommy bar, and this has to be parallel in line with the forearm, and that gives you the desired retroversion that you want. So after the canal has been prepared, you assemble the stem and the humerus head on the back table. Very rarely, if you are still unsure about the size of the head, you still have the modularity, and the best part is it gives you the option of inserting the stem first, and you can still do a trial reduction if you are unsure, and do a final impaction in vivo when the stem has been implanted. But many times it is possible to be sure of the size, so you can assemble the head onto the stem on the back table and just insert it in the standard fashion using the 3rd generation cementing technique, and here is an impactor to keep it pressurized. Whereas if you want to use the retroversion, guide, then it won't be possible to use the humerus head. You will just have to insert the stem separately, remove the retroversion rod, and then tap the Morse taper on. So after the stem has been cemented in place, then you just have to use the standard reconstruction techniques to get the tuberosities back onto the shaft, and use the soft tissue repairs for healing of the tuberosities in fracture cases, and do a standard closure. So this is the standard operating technique for the Biotech Hemi shoulder replacement. Thank you.